Okay, we have developed one tech platform where we are
Mm,
going to deploy that Enigma Health Sport for the students.
mm, mm,
Because
mm,
in addition to that academic score, right now the health assessment is very important. But
mm,
most
mm,
of the schools are avoiding that part. And we need
mm,
to
mm,
be take care ki how we can take care for the student overall
mm,
development in terms of academic, in terms of health also. And because
mm,
of the COVID, which is impacted a lot to every single people, nowadays immunity is also day by day it's getting diluted.
mm, mm, mm,
And day by day, the due to this NCD non-communicable diseases that considered as a diabetic, blood pressure, mental issues. So in the
mm,
early stage, if we can diagnose these parameters, that will help the student to get the preventive guidelines as soon as
mm,
possible, so they can be get cured with
mm,
the
mm, mm.
early doctor consultation and the medication. And medication that you can take whatever it's suited for you. We are not going to recommend that part. That is homeopathic, Ayurvedic, allopathic. But yeah,
Mhm,
in order to get cure, you have to be understand what is the problem that can be happen into the future and what
mm,
is the current situation of your health. For
mm,
example,
mm,
if I ask you from the last year to this year, how much immunity is getting compromised? So do you have
mhm,
any answer for that one? Ki, okay, that we can actually calculate. Okay, last year my immunity is some percentage like 50%. So this year
mm,
it's come as a 45%. So in terms of comparative study, we don't have any such technology right now which can
mm,
actually going to be examined. Okay, how much immunity that we have lost from last year
mhm,
to this year.
mm,
So this is going to be help you for the immunity assessment. The second
mhm,
thing, okay, if the student is getting that because it is a development stage for that student, so they needed to be take care whether the BMI is good or not, whether they are
mhm,
overall mentally they are fit for doing certain things or not. Because nowadays that due to that adult stage, that suicidal tendencies also developed in the very early stage. So if
mhm,
you are unhealthy, so your mental health is also directly impacted with this thing. So I need
mhm,
to understand by cross-examine some of the medical data, whether it is a blood pressure, some of the diabetic, some of the vital parameters that can
mhm,
help to understand the pattern of it. So this is how
mhm,
that we are going to be helped. We have developed one technological platform where the student can create a profile. It will just take up within a 1 minute. That data and information going to be stored in our database, and our research expert, dietitian, nutrition, and other doctors going to be examining this report with the different set of analysis.
mhm,
Now we
mhm,
are going to make a complete health report, and we are also going to be helped to make them call ki, okay, this is the things that you need to take right now, like all the preventive guidelines. So as
mhm,
a student, you will get this technical dashboard where you can get key overall student performance of the health. You can consider as a health attendance right now because of the COVID,
mhm,
ki how many population they are feeling healthy, they are feeling unhealthy, they are feeling good. Any kind of physiological symptoms, whether having a fever, diarrhea, loose
mhm,
motion, or it could be anything. So all these
mhm,
parameters can be analyzed very precisely with this platform. So overall,
mhm,
what we are trying to make it sure, a student will going to be create that medical history also. So this
mhm,
platform that we are going to explain here access the medical. So let's suppose your school is nearby some hospital. So we can
mhm,
make this hospital to connect with this student basic health
mhm,
profile anytime, any kind of medical emergency it will become. We
mhm,
are going to facilitate all the historical medical background, including their EMR and every single thing that will
mhm,
immediately transfer to that hospital so that treatment can be effectively can be achieved. Because once you have that historical medical record, that will help a
mhm,
lot. Okay, that student how many times get a fever, what is his
mhm,
health condition, how exactly you are in terms of as a person.
mhm,
So doctor
mhm,
can get a better understanding to give a medication treatment, so all these
mhm,
things going to be improve the treatment process.
mhm,
So this is
mhm,
all things are there. So early stage treatment obviously it will going to reduce the lot of financial burden as well.
mhm.
So this is the overall objective.
Okay.